Hi folks, welcome to my channel or welcome back. My name is Kat. I'm a licensed registered dietitian nutritionist and online nutrition coach. I focus in on sports nutrition, digestive health, prenatal nutrition, as well as overall practices that support physical, mental, social, and emotional well-being. Today, we are talking about digestive health, or also known as gut health. I'm trying to focus on adding some more variety to my channel versus just the deep dives. So more reactions, but also more nutrition information. Digestive health can be really confusing, and all the talk about gut health makes it kind of seem scammy. And a lot of gut health information out there is kind of scammy. But let's talk about actual gut health or digestive health. If that sounds good to you, then let's go. Everything in this video is for entertainment and education purposes. Before making any changes to your intake, to your diet, please ask your medical doctor or your registered dietitian or your health professional in general before making these changes. Basically, don't go implementing anything that you get from me and then try to get me in trouble. So when we're talking about digestive health or gut health, what I'm talking about is kind of this umbrella term over many different areas. Digestive health literally can go through the entire digestive system, starting from your mouth all the way to where your poop comes out. And throughout those different areas, we can have different kind of concerns. Digestion does begin in your mouth through the mastication process or chewing, and also through salivary amylase, which is a kind of enzyme that starts to break down those carbohydrates in order for your body to use them for energy. But mostly what we'll be talking about is things that are below the stomach area to the colon or large intestine. Within that area though, you can have so many different things going on, and that is actually why, one of the reasons why I can't stand companies like Plexus, who encourage their distributors to treat gut health. And maybe if they don't like outwardly encourage it, at least the distributors, their uplines and their sidelines, they are all encouraging it because they do it. I've seen it so many times. I have a video I'll link up about some claims that Plexus has made before, specifically about gut health, but also other aspects of health. So check that out if you haven't watched that already. So I'm going to talk about some different areas, and each of those areas can have very different protocols, and those can look very different between people even. Now, most of the time, by the time people come and see me with their digestive issues, they have already gone to their doctors, they've been through those visits, and they've been kind of investigating what's been going on. Their doctors have been able to rule out some of the following conditions that I will mention or identify them. So I wanted to talk about this because we'll go more into specifically IBS, because that's mostly what I'll see. I'll see some of the lists that I'm about to read out. However, sometimes these can kind of overlap over each other, where you can have somebody who has these kind of symptoms, which we'll talk about, and they'll also have something like one of the things on the list. And so it's important for the doctor to rule these out or identify them before we start to do any kind of protocol. So one of those would include celiac disease. There's a few different ways of diagnosing it. Some are better than others. Occasionally I'll have people come to me with not having thought too much about their symptoms. Specifically for celiac, there are a lot of non-gastrointestinal symptoms, and so sometimes just going through the intake form and figuring out what was going on, I have sent them over to their doctor to get tested specifically for celiac, and have had a couple of positives in that way. So that's pretty cool when we can catch something like that. But generally, once they're with me, they're kind of at a dead end of not really knowing symptom-wise, other than medications, how to reduce them. So celiac is kind of different in that way because there are so many other symptoms outside of gastrointestinal. Something else that a doctor is going to rule out or identify is certain kinds of IBDs or inflammatory bowel diseases. So this would include things like Crohn's disease and ulcerative colitis. Unfortunately, at least right now, there is no single test to identify an IBD. Diagnosis is typically made through their personal history, a physical examination, a couple of various tests, including blood tests, stool samples, endoscopy, biopsy, and imaging studies. So it's kind of like a collective of those tests rather than one specific test. Also, diverticular disease. Diverticula can be seen on a barium enema or through an endoscopy. And once that is inflamed, or those are inflamed, you can have diverticulitis, which can be diagnosed on that clinical examination during that acute attack or that inflammation going on. And usually it's going to be confirmed with a CT scan. Sometimes they also have to rule out certain kind of cancers. They can rule out or identify pancreatic exocrine insufficiency. So they would do that through some indirect tests. And usually you'll see a reduction in symptoms pretty quickly after they introduce pancreatic enzyme replacement therapy. This is one of the reasons why when somebody just says, add enzymes or something, like you really want to kind of figure out what's going on before just adding in enzymes and then seeing if you feel better. Like, let's see what your doctor has to think about that, because if there is that insufficiency, something they kind of want to make note of at least, versus just kind of adding these additional enzymes if there's actually something going on. And just as a side note, enzymes are kind of a fancy way of kind of scissors for your food, but basically you can kind of think about two like food molecules that are together. So let's say amino acids that are in a chain, several amino acids long to make that protein. So you have these two amino acids. An enzyme is kind of like scissors. It's going to go there and cut the bond between them so that you can go ahead and utilize those amino acids individually. So if you are lacking any enzymes, then in my opinion, that's something that your doctor should know about. They also can rule out or identify bile acid malabsorption or anything going on with your gallbladder. And then there's a few other ones that might be a surprise. Those include pelvic floor disorders, endometriosis, and even some endocrine disorders like hyperthyroidism. We'll talk about how those are related to digestive health in just a little bit. Now, there are, depending on where you're going, what you're seeking out, there can be and there are some pseudo-diagnoses. Now, these are based off uncertain scientific principles, which make them kind of pseudo-diagnoses. These specifically present a risk to patients because they may delay correct diagnosis or treatment to any of those other ones that we just spoke about. I see it in a lot of the more pseudoscience arenas. I will have some notes a little bit later about food allergies and food sensitivities. Those are going to be a little bit different because those are more immune system related versus a functional kind of disorder or condition going on. So IBS is a kind of functional bowel disorder. Functional bowel disorders are diagnosed with criteria after those other things that we talked about are excluded. So within functional bowel disorders, that can include constipation, diarrhea, abdominal bloating, abdominal distension, unspecified, and also opioid-induced constipation. IBS is thought to affect between 7 to 15% of people worldwide, and it seems to be more common in women than it is in men. And it is most often diagnosed before the age of 50. This is actually one of the sad parts about IBS. Although it is somewhat common, it's often undiagnosed. And undiagnosed IBS, even diagnosed IBS, can cause a lot of issues in patients because it can affect their quality of life. They can be left feeling anxious, frustrated, with lots of concerns, lots of confusion when their doctor kind of rules out, it's great to hear that you don't have any of those other conditions, but at the same time, you might also be concerned or confused of, well, what do you have? Because there is something going on where you're experiencing either quite a bit of constipation or quite a bit of diarrhea or a mix of the two, and basic recommendations, fiber intake, vegetable intake, water intake, that doesn't seem to really have any improvement on those conditions. And so it can leave the person feeling very anxious and can lead to that reduced quality of life if they are unable to identify and implement effective targeted therapies. And that's what we would do in something like this case. This is a kind of example for medical nutrition therapy. So what is the cause of IBS? The cause of IBS is unknown, it's likely to be multifactorial. There's a lot that goes into the cause of IBS. Some of those factors that are proposed to potentially cause IBS include altered gastrointestinal motility, so kind of how fast and how everything is moving along, that like peristalsis of everything, visceral hypersensitivity, so like how everything is feeling. There could also be impaired perception and processing of information in the brain to the digestive system. There could be low-grade inflammation going on, and in that case there would be some immune system activation going on. Sometimes I see, and this is why I really wanted to talk about the food sensitivities in particular later, because sometimes there's kind of this connection of everything. IBS is a puzzle. And when I mean puzzle though, that doesn't mean that we can't figure out what's going on and we can't have these kind of targeted therapies, but it's definitely an individual thing. And I have not had a single 2 patients react to the exact same things in the exact same amount. Everybody is so unique, and that's part of the reason why I love focusing in on digestive health. Also, intestinal permeability, that could be part of that multifactorial cause for IBS, and also alterations in your gut microbiome that live in our digestive system who help us to digest foods and keep us healthy. So something like small intestinal bacterial overgrowth would kind of be like an example of that, but not the only example. So if you noticed, the very last one that I mentioned is the one related to gut microbiome. That is the one that so many MLM distributors get super hyper focused on. Talking to you, Plexus, there are so many other aspects than your gut microbiome when we're talking about IBS. And again, just another reason why I can't stand companies like Plexus who have distributors who are making these wild claims, or other companies as well. Anybody who has a probiotic. We're talking about Arbonne too, Monash has a product, and you will hear distributors recommending it for people with IBS, for people with gastrointestinal conditions, who post on their Facebook page or in a group just talking about how their symptoms are doing, and then you'll have them slide into the DMs and recommend their specific probiotic, which one, even when we're talking about, let's say there is a specific probiotic need, even within that, you cannot have this kind of one-size-fits-all approach to probiotics. And backing up that next step, we can't have this kind of just gut microbiome focus when we're talking about IBS. It's so much more than that. Okay, so major IBS symptoms. There are a few of them. Common symptoms include constipation, diarrhea, or a combination of both, an altered bowel habit. There's also going to be lower abdominal pain as another symptom, bloating, which is that kind of feeling that there's almost a balloon inside. This is different from distension, which is the actual visible increase in abdominal girth, but they're often together. And there's that excessive passage of gas. These symptoms can come and go, and the severity of them can really change from individual to individual. There are currently no pathophysiological tests for IBS, or at least to adequately diagnose it. Instead, the medical doctor will likely use something called the Rome criteria or Rome 4 criteria, in addition to excluding all of those other things and just looking at that patient's history. So these criteria allow the medical doctor to identify whether it is what is predominant about that IBS, whether it is IBS-D for diarrhea, IBS constipation, or C for constipation, or IBS-U for unclassified, or IBS-M for mixed bowel habits. So they can use the Rome criteria to refer to the Bristol stool chart, which is a tool that is used to classify human feces on a point system, essentially, or a type of system. Now, if you have worked with me for digestive health, or outside of digestive health, then there is a high likelihood that you've probably seen this beautiful picture popping up somewhat often depending on the case. This is one of my favorite tools to use with people. It really helps me to get a better idea of what is going on and then also what to focus on as far as protocols go. So that Rome criteria, I'll put that up on the screen. So it's referring to that Bristol stool chart. So let's say if you have more than 25% of bowel movements with the stool type 1 or 2 and less than 25% of bowel movements with the type 6 and 7, that might classify you as IBS with predominant constipation or IBS-C. The opposite would be that IBS-D. If you have a mixture, then it could be that M. And if the bowel habits cannot be accurately categorized into one of the three groups, then it would be that IBD unclassified. Basically though, the reason why we want to really rule out those other conditions is because that all of those symptoms that I mentioned of IBS can actually overlap with those other conditions. And so if somebody is just having those symptoms, they might think of that as IBS and miss one of those important diagnoses. And so with this picture, also from Monash University, I think it does a really good job of showing how those IBS symptoms can overlap with some of the symptoms in those other conditions. And this is where I said that we'll see about endometriosis and pelvic floor disorders. You can see that some of the symptoms of endometriosis and pelvic floor disorders can be overlapped with IBS, as well as all of these other conditions too. And so that's why I said it's really important to, when you're having those symptoms, the constipation, the diarrhea, the mixture of them, the gas, the bloating, the distension. It's really important to get those things ruled out versus to just listen to somebody trying to sell you a probiotic. Most of the time that's going to be from people, distributors from a nutrition-related MLM. So again, one of the other reasons why I can't stand when a nutrition-related MLM company will talk about gut health, because you can potentially have people miss any of those other really important conditions because they have those overlapping conditions with IBS. So even when I am working with someone, I will look out for red flags. Those red flags are flags to me to tell them, again, to go to a doctor or go to another doctor in order to rule things that are completely out of my scope of practice. So some of those red flags might include unexplained weight loss, a family history of bowel diseases, onset of these symptoms after the age of 50, persistent daily diarrhea, changes in your bowel habits in the nocturnal hours and the later hours, rectal bleeding or anemia, fever, recurrent vomiting, and or progressive or severe symptoms. So now that we got all of those important things out of the way, let's move into more of IBS. So in the past and still currently, some people will use breath tests in order to diagnose malabsorption of certain kinds of carbohydrates. Breath tests have been used to identify if anybody has any malabsorption of fructose, mannitol, sorbitol, and lactose. Those are all different kinds of carbohydrate chains. Those breath tests will measure the amount of gas that is coming out of that person in their breath after consuming a test amount of that specific sugar. Those breath tests are based on the premise that poorly absorbed sugars are going to be fermented by the bacteria in the gut, the intestinal bacteria. And that is gonna increase intestinal gases, including hydrogen and methane. These gases are absorbed across the intestine, carried through the bloodstream to the lungs where they are expelled or breathed out, and they're collected. So if there is a rise in either the hydrogen or the methane, then it's interpreted that those specific sugars are being malabsorbed. If symptoms occur during or soon after, right after, then an intolerance to the sugar is reported. Now, despite widespread use of these breath tests, there are several reservations about the reliability and clinical value that these tests can actually provide. So based on newer information, breath tests should not be used in order to have exclusion of those specific carbohydrates. Another way of saying that is that breath tests should not be used to guide dietary restrictions. Occasionally I'll see that, but that's more of old school practice, and I see it less and less. And those patients should be encouraged to follow something like the 3-phase FODMAP protocol in order to determine which of those kind of sugars are causing those IBS symptoms, and also which ones do not. While those breath tests might not be helpful for those other kind of sugars, they can be pretty helpful for identifying any kind of lactose malabsorption. But even in the case of lactose intolerance, most people can tolerate between 12 to 15 grams of lactose throughout the day, and that's a little bit different than some of the other malabsorption concerns, because most of the time when we're talking about lactose intolerance, it's going to be because of an enzyme deficiency. Specifically, we were talking about enzymes in the very beginning, if you remember, but this one is specifically lactase, which depending in certain kinds of groups of people and also depending on your age, as people grow older, they tend to have more of a lactase deficiency, which is an enzyme, those scissors that kind of come through and break up the lactose molecule. And so an example of like some of the over-the-counter medications that you can get, they're literally just the lactase enzyme. So like you're consuming those little tiny enzymes, those little tiny scissors that are going to help you to cut apart those lactose molecules. That's what those are essentially. So talking about therapeutic options for IBS, specifically on the diet side, there's a few different approaches. Dietary eating modifications. These can be aligned with something for GERD or gastrointestinal reflux issues. There's some overlap with that, but that could include avoiding like spicy foods, could be avoiding caffeine or a certain amount of it, reducing the total amount of fat intake in one meal, spreading it more throughout the day, reduction in alcohol intake, and also increasing water intake. There's also sometimes a modification of fiber type and fiber amount. There are so many different kinds of fibers. There's insoluble versus soluble, and even within those you also have highly fermentable kinds of fibers, moderately fermentable kind of fibers, and then non-fermentable fibers too. So all of those modifications can also help potentially, depending on the case, depending on the person. There's modification of meal patterns and meal size, portion sizes in that meal. And then there's also exclusion diets. Now, these kind of exclusion diets, or this kind, is different from the kind of exclusion diet that we might do for an actual food sensitivity immune response. This one is specifically talking about FODMAPs, or the restriction of certain kind of fermentable carbohydrates. There are some other therapeutic approaches as well to IBS, including medications, lifestyle changes, supplements, even psychological therapies as well. So moving into FODMAP specifically, because I get a lot of questions of what FODMAPs are, and there's a lot of misunderstanding around FODMAPs and this kind of thought that you need to do this kind of protocol or FODMAP diet for long term, when that is not the case, not the recommendation, and not the intention of the people who created it. So as we mentioned before, there are some nerves in the digestive system that can be overactive. As a result, normal changes in the digestive system or the gut, like the amount of increase in gas or water in there, what can be a normal amount, can be experienced as painful episodes of bloating and abdominal distension, when really it might be a normal amount, but just that heightened nerve sensitivity. So when FODMAPs are ingested, they can attract some water into the small intestine, and this causes the intestines to kind of expand or distend. This can cause some motility changes, or the changes within the contents of the gut and the gut itself. FODMAPs are poorly absorbed in the small intestine, and so by the time they get to the large intestine, bacteria use the FODMAP in order to live, to survive, to thrive, using them as an energy source. Bacteria can can ferment those FODMAPs and produce that gas as a result. These actions cause this kind of expansion of the intestinal walls, like that kind of stretching. And because people with IBS can have more of that sensitivity, that stretching can cause some of that exaggerated sensations of pain and discomfort. So it's definitely happening, going on, and they're feeling it a little bit more than what someone else without it would feel it. So as you mentioned, FODMAPs are groups of short chain, small, tiny carbohydrate chains. They're small in size, they're poorly absorbed or not absorbed at all in the small intestine and the large intestine, and they are rapidly fermented by gut bacteria. Sugars classified as FODMAPs include oligosaccharides, which are fructans and galactooligosaccharides, polyols, which include sorbitol and mannitol, fructose, and lactose. So FODMAP itself stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So each one of those groups are a little different in what's going on and why they can cause those symptoms. And so that's why it is important to work with somebody who is trained in, if you are wanting to implement the FODMAP diet, it can be really confusing. And so it's really helpful if you're working with somebody who understands it. So really briefly, there are 3 phases of the FODMAP diet or the low FODMAP diet. Phase 1 is going to be at the minimum 2 weeks. I really like to push it out to 4 to 6 weeks at the max. That 4 to 6 weeks really seems to be anecdotally better as far as symptom reduction goes. So in that phase 1, high and moderate FODMAP containing foods are swapped out for low FODMAP foods. It really, from the outside looking in, it doesn't make a whole lot of sense why certain foods are high or moderate FODMAP versus low FODMAP. There's what it seems like there's no rhyme or reason to it. It's just the specific foods itself. So the people will follow a list of those low FODMAP foods. Now in this time, it's also important to make sure that they are eating enough, that they're getting enough balance of carbohydrates, proteins, and fats, that they're getting within the carbohydrates, that they're consuming low FODMAP, that they're getting ones that are still a good amount of fiber, that are still going to support the healthy bacteria in their gut. Because what we don't want to do is a long, drawn-out process where we kind of alter those gut microbiome varieties. Then you move into phase 2. This is one of the most exciting phases because we are reintroducing all of those different areas. So in the background, their intake still remains low FODMAP while we are introducing those specific groups. They're based off serving sizes, and so for each group, they'll have 3 different serving sizes. The first day being the smallest amount, the second day being a moderate amount, and that third day either being a high amount or the amount that they would normally consume. So there's a whole kind of schedule for those, and even within some particular ones, it's better to do them back to back, like every single day. With other ones, it's better to do one where you have a washout period every other day. So it just kind of depends on the kind of group and also how severe, how much you had those symptoms. And then maybe this one is my favorite one, phase 3. That is actually the liberalization of the diet, which is right up my alley if you know me and my channel. By phase 3, we should know which specific FODMAPs really trigger that person, which ones are tolerated better, and also the amount, the threshold that does the triggering. So for example, someone can do well with that moderate serving size, but have some more of those symptoms and issues with the higher size. And so it's figuring out what those thresholds are. If you do have any questions about the FODMAP diet, I am certified through the Monash University Dietitian course. Monash is the leader in FODMAPs. They really, all of the information out there is just phenomenal. Or if you're looking for someone more local or somebody who's not me, then you can always go on the Monash app or the Monash website and actually search in the directory for a dietitian who is closer to you. So the important thing to remember about FODMAPs is that it is not meant to be forever. You are not meant to stay in phase 1 following those low FODMAP foods forever. That's not the goal. All right, so this is not a sponsored video, but I did want to share a resource that I recently found that I think is really helpful or can potentially be helpful depending on the person. And this would be for people who might benefit from specifically the FODMAP protocol. So it's not going to be everyone, but specifically those people with IBS who have everything else ruled out. This resource is actually, I think, amazing. Right after this, I will be talking about food allergies and food sensitivity, so stay tuned for that. Hello, we are now in the kitchen, and so I'm excited to share with you some of the meals that Modify Health was able to share with me. So what I've heard about Modify Health is that their food is delicious, and I know that it's fully prepared, which is awesome. It's Mediterranean, low FODMAP, and gluten-free meals delivered to the customer's door. And paired with dietitian services, their meals can really help us to get on that path to having overall wellness with that Mediterranean component and recognizing any like certain triggers or of foods that's related to that low FODMAP, or to gain that ongoing support and control of digestive health. One of the things that I think is really helpful with Modify Health and just the idea of it is, let's say you are mostly doing your own kind of food preparation and we're in that phase 1 of that FODMAP plan. Sometimes it can be really nice to have a little bit more variety. That first phase lasts at the shortest, pushing it is like 2 weeks, but I really like to do it for around 4 to 6 weeks. That's where I see the most improvement. And so having an option where you can have more variety, I think I'm always a fan of more variety, like just in general. You know me, I like to limit as much restriction as we can. When you're talking about digestive health though, sometimes we have to push a little bit more of that restriction, unfortunately, when we're trying to figure out kind of what's going on. And so something like this is, in my opinion, really beneficial because that is directly aligned with having more variety. So something else is that they have free shipping on all of their orders, and because everything is vacuum sealed, it is able to last fresh, good, safe in your refrigerator for 7 to 10 days, which if you are still doing your own kind of food preparation, which I always encourage, we're not going to have that last as long, right, in food safety protocols. And so the fact that this can last a little bit longer, maybe you just want to get like a box and kind of try it out. You can also put some of them in the freezer. They last up to 4 months in the freezer. So the fact that it is well insulated allows for that food to maintain its freshness and its safetiness along the journey to your front door. So that's something that I really appreciate about the idea of Modify Health. So I mentioned that there's free shipping on all orders, and because it is actual food, so we want it to stay safe, right? And so it is fully insulated, and everything inside the box is curbside recyclable. So that's awesome. Okay, so let's go ahead and open this up. Let's see. This is the top. It is very well insulated. It's like an inch of insulation. I can feel the coolness inside. And I think there's only supposed to be like 2 meals in here, if I remember correctly. It's just like a sample, just kind of see what the gist is, see how kind of the flavor profiles are. And I am planning on putting in my own order and trying some other ones as well. All right, so the first one is, mac and cheese with barbecue chicken and broccoli. So this is what it looks like. You can see the barbecue chicken, the mac and cheese is kind of on the side, and then the broccoli underneath. It has a lot of protein. This is gonna fill you up for a good amount of time. Next one is this one. I was excited for that one, but this one more. So it's roasted salmon with spinach, tomato, and rice. You can see the salmon, the rice, some of the tomatoes and spinach, and then there's also some sweet potatoes down here. This looks amazing. Microwave for 1 to 2 minutes. You're not gonna be waiting there for like a long time. These are not little like baby meals that are gonna leave you feeling hungry. I think that's one of the things that I appreciate that I didn't know. I was just gonna see like what the size of the meals actually were. Okay, moving this. My husband just called and I got off track. What was it? Oh, yes. These are not like a Optavia kind of thing. Like these are actual meals. but it's focused for people who are experiencing or who have those specific needs digestive wise. And so it just fits really well with what I do. Of course, not everybody that I work with has digestive issues, but a good amount of them do. And so having this as an option to maybe have here and there, or maybe to have a couple of them saved in the freezer when they don't get that chance to do that kind of meal preparation, or they have kind of a wild week, I think this is a really great option. So with this, I was provided an affiliate code, a referral link, which I will have all the information listed down below. The code itself is CATRD, and this will give you $20 off your first 3 orders. So that's $60 off total. So I just want to be clear about that. That is an affiliate link. All the disclosures. I'm about to try one of these right now. I want to have the roasted salmon one, but I had tuna today for lunch. Normally, I wouldn't care about having fish twice in a day, but because of being pregnant, I'm going to go ahead and save that for later in the week, and I'm going to go ahead and have this mac and cheese with barbecue chicken and broccoli. So it's microwaving right now. I would show you, but my microwave needs to be cleaned like yesterday. Okay, so this is what it looks like. I'm actually really excited to try the barbecue chicken because barbecue sauce is one of those things that most of the time it contains some higher FODMAP ingredients. And so there are specific low FODMAP barbecue sauces specifically for this purpose. And so I'm excited to try how that tastes. And then of course the pasta is going to be gluten-free as well. So always good to try that, make sure it tastes good. And then the broccoli, the amount that is in here, it's good. It's not going to be above that normal higher FODMAP amount. Okay. So the pasta, the mac and cheese, as far as the texture, the mouthfeel, I wouldn't know that it's gluten-free. It doesn't taste like it's frozen. It comes fresh. It's not frozen and then it defrosts when you get here. You can make it frozen, but that's not how it comes. And then as far as the flavor goes with the mac and cheese, it's not the most cheesiest kind of flavor, but I feel like it is a satisfying one. It's not gonna be this kind of mac and cheese that you have at maybe your aunt's house for Thanksgiving, but for what you want to have to make you still feel energized and well and nourished throughout the day, I feel like this is what I would go towards. Okay, and then for the chicken, let's see how it goes. So easy to cut with just a fork. I don't have a knife with me right now. I could get one, but we're just using a fork. Okay, so the chicken is good. I was wondering how the barbecue flavor would really come up. It's a softer barbecue flavor. It's more, you can definitely taste the tomato-ness of that barbecue, which makes sense because it's a little bit more on that redder side. It looks more tomato-y, and so you can taste that. It tastes like barbecue sauce, and at that same time you can kind of taste the really tomato undertones of that, or overtones. I don't know how to describe it, but it's good. And especially the fact that this has 0 onion and 0 garlic in it. If it did have it in there, then it wouldn't be low FODMAP, but the fact that they're able to have this kind of flavor profile throughout the whole meal and it still be low FODMAP, it's one thing to be Mediterranean aligning or to be gluten-free. Those can become challenging, but you can still have a lot of variety. When you add on top of that the low FODMAP protocols, the variety of flavor can be a little bit more challenging. And so I think this meal actually tastes really good. I have not worked with them before, but based on my experience of how substantial their meals are and how it fits and it aligns with a lot of what my clientele would need or benefit from, at least at some point in their stage of figuring out what's going on. And this could obviously change in the future, but right now this would be actually something that I would be I would try it. This is actually something where I would feel comfortable and confident, at least right now, with the knowledge that I know about the company and my experience. I would be good with recommending it. I don't know if you hear my dog running. He's running around. All right, so that's it for this portion. Let's go back to the office. Now let's talk a little bit about food allergies and food sensitivities. So a food intolerance would be something, a good example of this would be like a lactose intolerance. So it's this kind of non-immunological reaction or response to the food. Your immune system has nothing to do with the food. It is purely functional related. There are true food allergies. Those would be like the top 8 allergens, your immune system responding to that food. That is another way of saying an IgE response, or the kind of immune proteins that your body is kind of sending out to respond in like a simple way. It gets a lot more complicated than that. So think of something like a peanut allergy. With symptoms of this IgE response, they can usually appear within seconds to minutes. These symptoms can include swelling, hives or rashes, itching skin, difficulty breathing, throat tightening, and that full anaphylactic shock in severe cases. There's also something called a food sensitivity. Now, this is a really exciting area. I'm really excited about it. It is still very new when we're talking about understanding the immunological response to foods from your digestive system. Now, in reality, when you eat anything, regardless of what it is, you are introducing an outside thing to your body, a foreign kind of object, food, to your body. And so it is normal to have some kind of immune response. Most of our immune system is in the digestive system because we are putting so many things into it. And so it's not going to be the same as that IgE response that we see with those food allergies. Instead, it's going to be an IgG response or reaction. Now, with these reactions, they can be normal and healthy and expected because you are adding this kind of food to your body. Sometimes they can be a little bit heightened and they can cause some other symptoms. And you can see these symptoms up to 72 hours later. Some of these symptoms can include things like headaches, nausea, bloating, gas, diarrhea, constipation. This is where you'll see that it kind of overlaps with some of those more functional reasons why we can have those symptoms. But you can also see things with food sensitivities causing some kind of headaches, joint aches, fatigue, overall weakness, and even some brain fog or memory issues. So in the past, IgG food sensitivity tests were not recommended because of the high likelihood of seeing these kind of false positives, that you had this kind of sensitivity towards something when really that sensitivity was there because you just ate that. You ate that recently within maybe even that 72-hour time period. And so your body was just doing that normal, healthy response for when it sees something like that coming into your body. So for a long time, food sensitivity tests and people, doctors, dietitians, they would just be like, not recommended. But as we continue to learn more, there are certain tests that test for more than just that IgG response. And so an example, like if you see a food sensitivity test that you can just buy in the store, in like Target or something, that's going to be pretty relatively cheap, still a little pricey, but relatively cheap. Usually those are just going to test IgG, and you can get a false positive, and you can be taking things out of your diet that you really don't need to take out. I use a specific brand. I don't get any payment for it. I don't get a kickback or anything, but the one that I use, it tests more than just the IgG response. And so the risk for having those false positives are so much lower. The other popular option for IgG protocols would be like the traditional elimination diet. But again, there are so many things within that traditional elimination diet that you could still have that food sensitivity to. Those are like the common ones that they can be common, not common in, like, when I say common, I don't mean like the majority of people. I mean this very small population with this kind of condition that we've ruled everything out. So that overall is kind of a bird's eye view looking at gut health or digestive health. All of those things are kind of a good screenshot or like shot of what goes through my brain when I hear any mention of gut health. Unfortunately, for a lot of people, when they hear gut health, they think of scam or they think of probiotics, like either of the two, when it is all of these things plus more. There are things that I didn't talk about within gut health specifically, but these are kind of the main, some of the more common things that in practice comes up. If you have any questions on digestive health, I would love to answer them. Unfortunately, as you saw from this video, it is so unique, but I'm not going to be able to give as much of a good answer unless we have this kind of full assessment. So keep that in mind. And also, if I'm giving individual information, that can fall under medical nutrition therapy, which I don't practice in my comments for legal purposes. So keep that in mind. So that's it for this video. If you liked it, please hit the like button. If you are not subscribed, consider doing that, only if you want. I will be back with another MLM deep dive in the next video. Remember, you can pursue health without subscribing to diet culture. All right, I'll see you later.